Okay, a new topic. So we talked about solid waste. Talking about liquid waste and reading about is what was a bit tricky. There is no separate chapter on this. There is a separate chapter on excreta disposal, and you will realize by the end of this session that this is something which should have been done. Thankfully, there has been a very good change. We'll also see what change has happened at the government level. Something has happened. So we will be talking about the liquid waste. What are the health effects? Some of the effects you already are aware of through sessions on water, and how it is being managed and surveilled. So this will be outlined today, and the resources which I have mentioned here, they are not very pretty informative resources. Not much is given on liquid waste only. Bhalwar has a chapter on excreta disposal. K Park has something in the same chapter on waste disposal. This is something which we will probably need about if you need to answer some of the quizzes and sometimes even short notes, especially the second one. So there has been a liquid waste management rule 2024, which is very much applicable to any doctor, any hospital or any nursing home. This will be pretty useful for you, and I have compiled some of the important information here in this session. So hopefully this will be useful for you. There is a long list of learning objectives. We will quickly go through all of them. So first, few important terms relevant to liquid waste and sanitation. Of course, liquid waste, then there are terms like sewage, sewage, grey water, black water. They are very similar, sometimes used interchangeably, but they have technical differences. Then there is a very famous term, effluent. You will hopefully be knowing about it. If not, there is a very important technical term called as bulk user of water, and this is a legal term in India now. So we will understand what that bulk user of water is. And then of course sanitation and sanitation barrier, which is often a very popular choice for short note, sanitation barrier and sanitation. Okay, liquid waste. So anything which is of liquid nature and which may have effect on human if it is present in a large amount. So liquid waste, sewage, sewage, grey water, black water, they belong to the similar category, and they have small but important technical differences between them. So it is any form of liquid residue which is hazardous, which we talked about, and potentially harmful to human health. So whenever we talk of hazard, and there is something called as vulnerability, which leads to risk, and anything you might be aware of, anything which is a risk factor may become a cause. I hope you understand that difference. So hazard, if there is a vulnerability. So small example, not related to liquid waste or environmental health, I will explain you. Can walking be a hazard? Simple thing. Can walking be a hazard? What do you think? Yes. Can it be hazard? You don't even think that walking even can be a hazard. Yet it can be a hazard if somebody is suffering from epilepsy. You got the difference? So epilepsy person, although he or she is not vulnerable, if it is a different hazard, sitting for him may not be a hazardous thing. So epilepsy, vulnerability, walking as a hazard, leading to that becoming a risk factor and causing potentially life-threatening, such as an accident, crossing a road and causing an accident. So you understood the difference. Hazard, vulnerability, risk factor, cause, disease, death. You are often asked about that, how to explain it. So any liquid thing may become hazardous, as simple as kitchen waste. I will explain with I will ask you first, then explain with a very pertinent example. Sewage, sewage, grey water and black water. Any idea what they might be related to? So I will ask people who are less interested, as usual. Hanji, second one, glasses. Sorry, I don't remember your name. Any idea what may be the difference, if at all, between sewage and sewage? It is asked as a quiz often. Aega, page entrance may or somewhere. And from the standpoint of a hospital manager, hospital owner, or a senior staff doctor in hospital, this will be useful, applicable to you. Bolo. Make some guess if you don't know. Start with, are they same? Are they different? Fine. Much different, not much different. Chalo, baith jao. I'll explain. Baith jao. Liquid. What about human excreta? The things which come out of our toilets. What that will belong to? All of these are liquid waste. All four. So human excreta, sewage होगा, sewage होगा, grey water होगा, black water होगा. So human excreta will go both in sewage and black water. The difference is black water is just a part of sewage. It also contains grey water. Technical terms. Both grey water and black water are technical terms. Sewage is nearly similar to grey water. So things or liquid waste or sewage without human excreta is sewage. Things coming out of kitchen, and these are not solid things, liquid waste. We have not been talking much about it. So if even out of hospital, it will be sewage. Things coming from laboratory, but that is not grey water. Grey water comes from houses, domestic grey water, kitchens and bathrooms, any similar community things, those are grey water. So they are a bit different, right? So you understood the difference between all five. Next we come to effluents. Effluent is anything which comes out of industries. So it is a waste or refuse which is coming out of industry as per the rules which we have by now, will become operational in 2025, this year in October. And some of the books or some of the other reports have these definitions for effluent. So things which is poured into water or air, even that is effluent. Wastewater, that is an effluent. It may contain a variety of pollutants, or it needs treatment before being discharged into either water or air, right? And they may cause pretty serious things. I'll ask a very small example. Ever heard of New Delhi metalloproteinase? सुना है? NDMA. Very serious condition. It causes very serious condition, infection which is not treatable by any known antibiotic. Why that might have happened? It's very unlikely that a single bacteria will have resistance to multiple antibiotics. Very difficult. By chance, it may take millions of years to happen through mutation or something. It happened very fast, and that too in India. All those liquid waste were the reason. So say for example, I am suffering from a very simple staphylococcal skin and soft tissue infection, simple furuncle, right? I wash my face. Where does that staphylococcus goes? A lot of them would be killed if I have washed my face properly with soap, applied it, let it stay using hand hygiene techniques or what microbiology has taught us. If not, that staphylococcus is now where? In the drain, in the grey water, maybe in the sewage, maybe in the sewage. Sewage has what? Lots of bacteria, other bacteria, E. coli or some other bacteria which are not harmful to us, but has resistance to multiple antibiotics. They get together, not treated. Now the sewage is not treated, and where will this sewage go into? Soil. पानी कहाँ बहाते हैं लोग? छोटे मोहल्लों का पानी कहाँ बहाते हैं? एम्स has something called as sewage treatment plant. Just remember your colony. Does that colony has a sewage treatment plant? I'll show you what proportion of Indians have treated sewage flowing into water. So that may cause a very simple thing, but for a doctor, as a doctor, that becomes really important to us. And you think of any infection, you can think of chemicals, heavy metals, think of whatever you can think, right? So those are effluents. It may even have radioactive compounds. There are industries which deal with radioactive compounds also and may get into our food, our day-to-day things. Dhania bada popular hai. Can be a very good medium. It has not much been studied. Some of you can study. A technical term, bulk use of water, is average water use is exceeding 5,000 liters per day, and hospitals and nursing homes are one of the eligible establishment which will become a bulk user of water. So AIIMS Bhopal, of course, is a bulk user of water, and we will read why it is important. This term is important. Sanitation, we know about sanitation, is provision of facilities and services for safe disposal of mainly for urine and excreta. Initially this was the term, now we have included other grey water, wastewater in sanitation. So it also sometimes is talked about that provision of drinking water which is safe and potable is part of sanitation. Process of keeping place free from dirt, even that has been used as the term sanitation. Sanitation barrier, whatever mechanism we put in place so that feces doesn't get entry into these five, either the water or the finger or the flies or the soil or the food, then it is called as sanitation barrier. And how do we do that? So we do it by these five methods. We segregate feces, protect water supply or protect food or personal hygiene or control flies. That's how we do sanitation. We barrier the have a sanitation barrier in place. Okay. So coming to the types of liquid waste, how people have classified, we don't have this classification in our book, but it has been classified by WHO and some other important documents. 4 types of waste, liquid waste can be considered. So domestic wastewater, industrial, agricultural and other types combined. It is based on how much amount or what is the place where this liquid waste is originating from. So other types, fog, laboratory based, it is really important for us as a hospital. Septic tank influence, sometimes we do not have a sewer, then septic tank comes into picture. We will see that also. We have talked about these 4 terms. So types of liquid waste. So now you have had some idea about sanitation barrier, you can try to answer this. Which of the following is the most effective step in sanitation barrier? Hanji. Yep, second last. No, not you, behind you. तुमको मज़ा नहीं आ रहा क्लास में, I can understand. You are very fond of your phone. You are prepared. That means you are prepared to answer these questions. You don't need these classes. बताओ. Very simple question. Take a guess if you don't know the answer. 3 स्लाइड पहले था. No, someone from the first here. You want to try? Segregation of faces. Yep. Good. Of course. 3 स्लाइड पहले था ना. Sit down. सबसे पहले नंबर वही लिखा था ना मैंने. So if you do that, we have the evidence also. What proportion of health diseases which is caused by poor sanitation can be prevented? So we have that answer. We have some number. I'll show you. So you should be able to discuss the role of sanitation. How? So sanitation and health. बैठ जा भाई. मैंने बैठने बोल दिया. So as a specialty, community medicine aims to break the disease cycle at vulnerable points using the principles of primary care. And when we talk of sanitation, sanitation was one of the most favored topics initially when it came into PSM, preventive and social medicine, social and preventive medicine, right? Preventive medicine. So sanitation, barriers, and people used to joke and wonder why we are, doctors I'm talking about, MBBS students, why we are reading about latrines, why we are reading about why feces should be disposed, why urine should be disposed. So, of course, so health, because it is really important from the standpoint of health. How? Just have a look at the risk factor for Delhi. Thankfully, poor sanitation as a risk factor has gone down. It has come down to this place. But initially, about 20-30 years back, it was at the top. There are countries in the world, there are states in India where still sanitation is really in the top 3 as a risk factor for Delhi. We understand what is Delhi. What was Delhi? Delhi बताया था ना, सिखाया था. बताओ. Yes, you. Okay, then let's try with topper. Top 5, any student? Who is the topper of the class? नहीं आया? नहीं आई? It's a he, it's a she. Student, boy, girl. कौन है? Who is the topper? बताओ. डाली नहीं मालूम, 2-3 बार क्लास में बताया. Said any PG student? Disability adjusted life years. If you have to express the burden of disease, how will you express it? You have to express the burden of a disease. You have to explain it to a patient, you have to explain it to a policymaker, both ways. Please take care of your health, you are having this disease, this is a very important disease, this is a very serious disease. You have to explain it. In what terms? We usually use percentages. What percentage of humans are suffering from a particular disease? And we have terms like, तुम्हारा study designs वगैरह पढ़ाया होगा ना? Epidemiology. So we have terms like prevalence and incidence. Those are percentages. In different situations, these are percentages only. 10 out of 100, 20 out of 100. These are percentages. 10%, 20%. But there was a problem. There were diseases which don't kill, like depression. They don't kill as much as people get killed by MI. Right? Agreed or not? कुछ तो respond करो. नाश्ता मैंने भी नहीं किया, तुमने भी नहीं किया. Okay. Then there are diseases like low back pain. You might have family members suffering from it, really suffering from it. Very bad shoulder pain. Agreed? They don't die. But if we use percentage as our parameter for a disease being important, that doesn't become very helpful. Then we have a very important other parameter like DALI. It contains two things: years of life lost and years of life lived with disability. So disability comes into picture. Someone having a very poor shoulder, someone suffering from back pain or migraine or depression becomes less productive, has a disabled life, nearly disabled life, maybe legally disabled also or just technically disabled. This is what we use when we have to show the importance of a disease or a risk factor, DALI. This is more important, and this is one of the parameter in our national health policy now. By 2020, DALI 2022 DALI has become the main indicator when we talk of health or any disease or any parameter. So sanitation, although now it has come down, it used to be very important. That is the first. Then if you remember this, one simple example, fecal-oral transmission. So there are a lot of diseases which transmits from feces to host through these medium. And we just learnt about the sanitation barrier which applies here. Right? And there is another barrier called as hygiene barrier, which applies here. So we prevent feces from going through these 5. If somehow they get entry into these 5, then we have to use hygiene barrier, hand hygiene, so that another, not only hand hygiene, food preparation barrier also, that it doesn't get into host. So it is really important. There are still infectious diseases which are prevalent in our country. So we have a triple burden. How do we break it? By multiple mechanisms. So at one place, at multiple places, we can do that. So there is a role of sanitation in health, at least through the infectious disease route. So why should we do something, safely dispose human excreta? Because it may cause a lot of pollution in water, in soil. It can contaminate food directly at a smaller scale. It can be important for propagation of certain vectors, the flies especially, because flies like organic matter. It will not use simple water, but it will, the contaminated water is a food for flies especially. Then there are other vectors which lay eggs in contaminated water because the larvae get food from there, and from there these larvae can become vectors for us humans. So if of course excreta is there, what is the burden? So 19% of household practice open defecation in India as late as NFHS 5, National Family Health Survey 5 survey says this. And this is hardly 3-4 years back, after a lot of effort by Government of India. Of course, there has been a good change. In NFHS 4, it used to be 39%. So now it is 19%. It's better, but still it is important, right? That means in absolute terms, how much? 27 crores of Indians. And if you have some vulnerable population to check from them, see 31% among STs. So 31% means it is quite higher as compared to everybody else. And then there are states where it is quite high. So these states, these populations are what we talked about initially, vulnerable populations. So there, the burden of liquid waste would be higher. So the liquid waste related diseases would be higher in those places. Only 12% had a sewer connection for wastewater. Rural में तो is very unlikely to have a sewer connection. Rather, probably that is one of the criteria how we define rural versus urban. Urban means there has to be a sewer connection. Initially, there was a different definition or understanding of शहर किसको बोलना है, गांव किसको बोलना है. Now, this is a very important connection. Do you understand the difference between a sewer and something called as a septic tank? Difference पता है? Yes, no? There would be a pipeline. So from AIIMS Bhopal, whatever human excreta is disposed of every day, every morning, it doesn't get stored somewhere. In a septic tank, it gets stored somewhere. And if the septic tank boundaries are not well made, then those infectious agents can gain entry into soil and water, right? But thankfully, that doesn't happen in a sewer connection. Those matters straightway go somewhere, and especially they go to, in AIIMS Bhopal, we have something called as sewage treatment plant. It's treated, being treated continuously. Is that better, or is the storage of human waste better? Storage or sewer? You agree? So we have only 12% people who had a sewer connection. Pretty low, pretty low. And open drainage was more than 42% as per this NFHS only. Open drainage means नल का किचन का पानी ऐसे बहा दिया. And we just talked about how this simple as dreaded as ND, New Delhi Metalloproteinase, NDMT, MP, that can come into picture. There would be more similar diseases, there would be more similar afflictions which may come out of this liquid waste coming out of open drains in form of either grey water or black water or sewage. Sewage would be in the sewer. Small example, 1 gram of human excreta has these many things. That's a lot, right? We need just a few for certain diseases. So hookworm eggs or which parasite? Enterobius or some other parasites. A lot of bacteria, E. coli, Staphylococcus, full of viruses, reovirus or cytomegalovirus, or you have rhinoviruses also, they can also be present. People spit, they will be present there. And the sewerage system typically reduces diarrhea. There was a study which I read about, that's what I am showing you. So they were able to show that if it is a well-maintained sewerage system, existing sewerage system which has been there for say 20-30 years, it will reduce the incidence of diarrhea by 30%. If there was no sewerage and the sewer line has been made newly, it can go up to 60%. Lot of change. So in rural areas, it may go as high as 60%, the diarrhea incidence will go down, and in urban tier 1 cities, it will be at least 30%. That's what has been shown. So we have a necessity of safe disposal of human excreta. Quickly, how we know excreta is disposed of? One way is to construct good scientific toilets. I will not go into details of that. I'll show you the types of toilets. So it can be classified in 2 ways: if there is no sewerage system and if there is a sewerage system. So we have different types of toilets. In sewerage system, it will be very simple. Any fancy commode or Indian toilet will do, right? Fancy, non-fancy. It has to go into that pipeline. That's it. But in non-sewered area, there would be lots of jugaads, and there is a history. I'll just simply show you. You can simply realize. So without sewerage system, it's not working. So service type, the most dreaded inhuman humiliating method, which was present, I think 3, 4, 5 decades back, when somebody had to carry that. People used to defecate. It was stored in some baskets or something, and people had to. There was a untouchability practice also. There was a caste which used to do that. And if you remember, Gandhiji was very much against that, and he tried to have the system, these kind of systems. These systems were present in Western societies at that time. Some of them pre-independence, some of them after independence. So simple hole or pit or a water seal type of latrine, which is more scientific. Still, the storage, there was a storage also. And if you remember Sulabh Shauchalayas in front of gate number 2 also, they do not have, especially in rural area, they do not have a sewer line or tier 2 or tier 3 cities. I am not very sure, tier 1 cities, do they have connection to the sewer line or they are stored only? My understanding is they are still stored only. And these two famed latrines which were developed in India. This was what was developed by Ministry of Health, this was developed in Lucknow nearly 30-40 years back. Some of the rural toilets still are of these types. You can see the figures from the footbook. Septic tank, which is very popular now in rural areas and in a lot of urban areas if there is no sewer line. This is something which is common. Aqua privy is very similar to septic tank. It has some minor engineering differences. And they can be suitable for camps and other temporary use, because in camp there will not be any sewerage type. So you can have simple trench or one of these two. So trench, pit or borehole. We cannot have these things in a temporary space. If we have to talk about sewers, so what happens in sewer area, depending on what kind of treatment can be applicable to the colony or the premises, maybe hospital, maybe other areas. So simple primary treatment call as things like screening, removal of grit or plain sedimentation, simply that and flush in the main pipeline. Or secondary treatment simply by having trickling filter and activated sludge process, because everything takes space and money and other methods also. So we have this entire thing at AIIMS Bhopal. Other hospitals now are supposed to have it. I'll show you why and through which guideline. And there are other methods also. So after sewer pipes are constructed, the human excreta goes through it and simply goes into sea. There would be towns which will be doing this. There would be villages which will be doing this, or smaller towns doing this. River outfall means simply the sewer line opens into river. Sea outfalls opens into sea without any treatment or with simple primary treatment and or other methods. This oxidation pond, if you take a train from Bhopal and you go towards, I guess, Itarsi, after Itarsi, there are 2 or 3 oxidation pumps in the bay. Oxidation ponds are simple open areas, simple methods of sunlight related oxidation. The sewer liquid waste gets oxidized and gets treated and converted into non-toxic water. That's what we can say. So these are present. You can very clearly, even if you cannot see them, you can realize that they are there because of the foul smell. Just passing through those. They are big water bodies. You might even wonder why these foul smelling water bodies are here. And now that you have understood it, so now you can realize, okay, this is an oxidation pond. Right? There are few here, and you can, if you go from Delhi to, I saw them, go Delhi to Chandigarh, I saw 4 or 5. In between, small villages के बीच में. शहर में नहीं होते ये. शहर वाले हल्ला मचाते हैं ना, तो गांव में होता है. Okay. So now you have some idea about it. You can very easily answer this. Earthquake आ गया, जो existing toilets है वो टूट गए. Sewer line, the pipelines have broken down. What will be done? The best one. Pit latrine, having a pit hole and a pit where the human waste is collected, or simple open defecation, or a water carriage system, which was there before these things came into, or community aqua privy, which is more sophisticated thing similar to septic tanks. कौन सा करेंगे? You might be asked, अब एक हेल्थ कैंप कहीं पे लगेगा एंड यू विल बी आस्क्ड कि अरे डॉक्टर साहब वहाँ हेल्थ कैंप लगना है, वहाँ तो कोई टॉयलेट था नहीं, तो बताओ क्या करें तुरंत के लिए, 2 दिन के लिए बस हेल्थ कैंप है. सिमिलर एग्जाम्पल, व्हाट विल यू सजेस्ट? दे विल आस्क यू, यू आर सपोज टू गिव द आंसर देयर. आप तो एम्स के डॉक्टर हो, आप तो जानते ही होंगे. हाँ जी, क्विकली, वो सोते हुए आदमी को जगाओ, वो आंसर देगा. गुड मॉर्निंग, जाग जा भाई, पीजी एंट्रेंस यहीं से होगा. यही सवाल आएंगे एंट्रेंस में. मैं भी एक सेटर हूं. तुम्हारा इंटरनल भी रह सकता हूँ, इंटरनल एग्जामिनर। जो क्लास में डिस्कस किया वो नहीं बताया तो गड़बड़ है। ट्राई करो इसका आंसर। आई एम जस्ट आस्किंग यू टू मेक अ गेस एट लिस्ट। गेस भी नहीं कर रहे। ओके, रॉन्ग सेट। वन मोर ट्राई, समबडी। बैग से चेहरा छुपाने वाले, हाँ आप बताओ। नहीं, तुमने नहीं छुपाया ना। अच्छा, तुमने भी छुपाया है। बता, तू हंस भी रहा है। हाँ जी, डी ए, चलो दोनों ही गलत, बैठ जा। बोथ ऑफ देम आर रॉन्ग। या 2 दिन के लिए ठहरना है ना। जितनी दिन पिट बनाएंगे उतनी दिन पता नहीं क्या ही हो जाएगा। देयर इज नो वे आउट। After a disaster, there is no way out. We have to do something about treating that waste, or maybe barricading that so that nobody goes there. That has to be done, and quickly construct a toilet. उसमें time लगता है. Okay, so quickly health effects. So simple. They are a nuisance, unsightly, smell, odors. Of course, breeding of vectors pollutes water and soil, contaminates food. And both infectious and non-communicable disease. Why non-communicable diseases? Anemia बढ़ेगा क्या इससे? Will we have higher rates of anemia? Anemia is a non-communicable disease, right? Will that increase if we have a lot of liquid waste? Yes, no, जल्दी बोलो. Yes or no? Will the rates of anemia increase if we have liquid waste? उतना लंबा चौड़ा वो एग्स दिखाया, किसका एग दिखा रहा था मैं? एग्स, राइट? किसका एग्स? किसका? किसका एग्स? Hookworms and ascaris. Then there are other non-communicable diseases. Any other non-communicable disease which you can think of? Think of heavy metals. Which diseases? Arsenic, lead, yeah, a lot of them. They will happen. Cancers, yes, no. We had agricultural wastewater. What does it have? उधर एक टेबल था शायद, I think, I don't know. सर अभी आएगा, I'll show you. Yeah. See, agricultural wastewater. It may lead to emerging infectious diseases. COVID. वहीं से आता है ना? Or similar kind of diseases. They will come from, if we do a lot of agricultural practices, newer organisms, emerging diseases. Emerging means some disease which has come for the first time. And then of course we have pesticide and nitrate related water pollution and causing, there is a cancer train which goes to PGI from some districts of Punjab because of very high usage of pesticides. Those pesticides cause cancer on prolonged exposure. Cancer hota hai. So non-communicable diseases also, and pretty others. We can think in terms of the origin of that liquid waste. You can think of the type of the liquid waste and what kind of diseases it may cause. See, fire hazard. Anybody from Karnataka? Bangalore? आग लगता है ना उधर, तो बोलो ना. Others, you are not wondering? पानी में आग लगती है कभी? वो पूछो उसको, उसके आग लगती है पानी में, लगती है ना? या यू डिड नॉट नो. अब आराम से बात करना उससे, ये कैसे हो सकता है, वो बताएगी सब. सी हाउ टॉक्सिक दैट वेस्ट वुड माइट बी. कम्युनिटी लेक है वहाँ पे, लेक बड़ा पॉपुलर लेक हुआ करता था, मेरे को नाम अभी भूल रहा हूँ मैं. वो लेक में आग लग जाती है कभी भी. सी फायर हजार्ड बिकॉज ऑफ फॉग. ये वो वाला फॉग नहीं है. फैट्स, ऑयल्स भरे हैं ना उसमें, घर से, इंडस्ट्री से, वो कभी भी आग लग जाती है. स्पॉन्टेनियस, किसी ने ऐसे माचिस फेंका तो भी लग गई, राख फेंक दिया. पीपल विल थ्रो दोज थिंग्स ऑल्सो. उसमें से चिंगारी से वी विल हैव फायर हजार्ड्स, कोरोसिव इफेक्ट्स. एसिड फेंका हुआ है इसमें, इंडस्ट्रियल वेस्ट में एसिड है. रैग पी बेचारे चले गए खेलने के लिए, गरीब बच्चे चले गए, नॉर्मल लोग ही चले गए मस्ती करने से, है ना. मॉर्निंग वॉक हैड है ना, क्या है वो हैशटैग हेल्दी नेचर के पास, पैर डाला पानी में, पैर में कोरोजन हो गया. क्यों हो गया? तुम्हारा उस लेक में क्या था? सल्फ्यूरिक एसिड का निकल गया. कहाँ से आया सल्फ्यूरिक एसिड? इंडस्ट्रियल वेस्ट. बगल में फैक्ट्री है. यू डिड नॉट नो दैट, राइट. So there would be somebody who is coming to you as a patient and you are wondering ये कौन सा disease को हो रहा है, कैसे हो सकता है. Then if you have an idea of these things, then you will be able to diagnose. Okay, so now the last part, the management and surveillance related things. So how do we manage it? So for management, I would be talking only about two, the domestic and a bit of industrial. I'm not talking about agriculture and other, takes a lot of time. So there are 5 steps. How do we do that? So we first characterize the liquid waste. You saw the table, and there is a bigger table also. So we characterize at the population level, we characterize what kind of liquid waste that it is. Based on that, the type of treatment method has to be decided. Then we collect and transport. Now we have laws. We are going to have laws from October. Collecting and transporting. After that, the treatment will happen. Transport is through either pipelines or through other methods. वो ट्रक से भी जा सकता है, ट्रेन से भी जा सकता है. You might be wondering, AIIMS Bhopal, I think after 4 or 5 years could be able to do something about its liquid waste. तो पहले कुछ दिनों तक वेस्ट यहाँ से ट्रांसपोर्ट होकर के some other hospital it used to go. That was really toxic waste coming out of laboratories. So that kind of transport also might be important somewhere. Then dispose safely. We saw the methods of disposal as bad as sea fall or river fall as good methods after treatment into things. So I'll show what are good methods here also. And then monitor and report accordingly. There was none till now in most of the places in India. Okay. So if we have to do that, you recall the water usage and activities I showed you in few probably second or third class. So there are activities like toilet or shower or bath or saving, and so you multiply in terms of liters also, nearly 4 liters for 1 gallon. So 30 liters by simple one conventional toilet. 30 liters of water is wasted in 4 flushes, urine or whatever, a lot of water. People are not getting 30 liters per person a day, right? Or full bathtub, lots of water. So we have these kind of examples. We have these kind of examples also in cooking, by opening water tap or brushing. See, कहाँ गया brushing पीछे था. Laundry or car washing. I gave you one example of people nearby. A lot of water is used, right? So if we have to manage liquid waste, because most of this water will become liquid waste, they are going to become either grey water or sewage or sewage gets connected to the human excreta and becomes bigger one. Remember the 5R. That's how you can do that. So you write the answer, you give the advice, you refuse, you reduce, reuse, recycle and recover. How do we refuse? See, simple example. All the top ones. Washing hands. Few days back, I asked one of the staff while we were doing Kayakalp assessment, show us steps of hand hygiene. I guess if I tell you, most of you will do the same thing, which is a mistake. You open the tap, you get some soap, you apply soap on your hands, and for 20-30 seconds you are showing very diligently, very happily, sir, aise karte hain. And all those 30 seconds, what is happening? The tap is open. See how much of water. You are brushing your teeth, the tap is open. Many of us do that. See, kahan pe brushing somewhere. Yeah, see, open water tap. So much of water. Kitna kam hai if you simply close it. That way, rural people are better because they use some conduit. They will have some mug or something. They will use lesser water. So we refuse in some places. We do not have this kind of things. So the standard cycle, वैसा वाला washing machine खरीदो ही नहीं जिसमें standard cycle होता है, और make those kind of settings. ये standard cycle चले ही नहीं, short cycle वाला use करें, है ना? और laundry full load अगर हो तभी भरना है. 5 कपड़े लगा करके मशीन चला दिया, अरे नहीं मेरे को तो बहुत साफ कपड़े चाहिए. So you have to explain to the people who are doing this. और CPCR में ऐसा करना भी चाहिए. What kind of things we did. Or so first is refuse, then we have reduced. We can reduce because we cannot ask somebody to not flush. That's a good thing. But we can change the flush so that we can reduce. So इस type का flush लगाएं कि वो reduce हो जाए. So we can reduce, we can diffuse, we can reuse also. So how do we reuse? So either it can be a planned or unplanned method of reuse. Industries can have a planned method of use. Domestic में usually it is unplanned. Places, home, कहाँ पे कर सकते हैं? Source. So how we can reuse. So simply rinsing food या vegetables, showering, dish wash, hand wash, laundry, इससे जो water निकल रहा है, that grey water, that can be reused. I'll show you how. One method very popular now, coming up in good many areas, and it has become a building bylaws now in most of the urban cities. So all rainwater has to be harvested. Rainwater is not suitable for drinking right now. I told you in earlier class also, the pure rainwater is considered the purest form of the rainwater, considered the purest form of water, but it is not the safe water. It will have impurities, both biological and non-biological, which will be coming up once it gets collected on tops of buildings. It becomes more contaminated. So that has to be harvested in a technical manner, in a scientific manner. So it can be other kinds of water can be used for these reuse for agriculture, irrigation, or simply refill the groundwater. If we allow the grey water to simply refill, to charge into the groundwater and let it be there, we do not draw that water through some pumps. That water gets treated naturally. It takes a lot of time, 3 to 4 months usually it takes naturally. The water gets oxidized through the bacteria and mechanism present in the soil and becomes better water, sometimes even safer. If we have to recycle water, both STP and ATP output water can be used for horticulture. You are seeing the horticulture pumps everywhere, right? In AIMS Bhopal, देखा होगा ना? And you might have read not suitable for drinking, because that water is coming from the STP near type 1 and ATP near hostel. अब तुम लोग उसको हाथ से छुओगे भी नहीं. You did not know that, right? Anybody who knew this? हाँ ना कुछ तो बोलो, right? But it can be used. It has been tested also that output, the water which is coming, it is tested microbiologically that it is actually safe. But still it should not be used for drinking. It can be used for other things. So for horticulture, public fountains, road cleaning, anything can be used. नॉर्मल वाटर क्यों यूज करें? वो टैंकर का पानी से रोड क्लीन कर रहे हैं, प्लीज नॉट, उससे कर लो, कार उससे साफ कर लो. सो हाउ डू वी मैनेज इट? डोमेस्टिक, कलेक्ट, स्टोर, ट्रीट एंड आउटफ्लो इन सॉइल और वाटर बॉडीज. तो डोमेस्टिक तो ऐसे ही होता है, इट डजंट कलेक्ट एक्चुअली, एंड यूजुअली वी डू नॉट हैव मच ऑफ ट्रीटमेंट हियर. हाउ कैन वी डू दैट? आई शो यू बाय सिंपल सीवेज ट्रीटमेंट प्लांट or effluent treatment plant for industries or even for homes if it is a hazardous hospital waste, liquid waste. This is an example of modern sewage treatment plant. Screening, grid chamber, primary sedimentation, biological treatment. If you want to really see this, please go and check it in our STP. We do not have time so that you can make a visit, but I'll advise you to quickly do that. For industry, there are rules. So rules are made by Government of India and enforced by agency called as CPCB, Central Pollution Control Board, and State Pollution Control Board. So MP will have MPPCB, Uttar Pradesh will have UPPCB, every state will have its PCB, Pollution Control Board. And there is a term called as occupier. Occupier is the entity, the organization or the person who creates the waste. So if we are a household, we are the occupiers, we are producing that waste. So they will have to get a permission. So AIMS Bhopal is a occupier, it has to get permission from the State Pollution Control Board to do initially 2 things. Consent to establish, हम अस्पताल बना रहे हैं, when you have to have your own hospital, you have to get this permission from the State Pollution Control Board. There is a special form for that. So get the consent to establish, we are going to start it, and then operate. Start means start the construction, and then operate means operate the services. So before that we have to get 2 permissions. So first before starting the construction, then before starting the services. And after we have got that, then we have to get a certificate for managing hazardous waste. वो बोलेंगे हाँ ठीक है आपने बोला था ये सब कर देंगे, this is the certificate, now you show us what exactly you have done. So for that another certificate, because even after operations have started, it takes some time when hazardous waste things comes into place, and then periodic renewals. I'll show you how periodically every 5 years there has to be a renewal. ठीक है? So the guidelines are given under the Water Act, and authorization certificate is valid for 5 years. The waste can be stored maximum for 90 days. Hospital का जो जहाँ पे भी store करते हैं, जैसे हमारा भी है. And we have the occupier means the hospitals have to keep a record of hazardous and other waste. So there will be हॉस्पिटल में तो पक्का hazardous waste होगा, especially lab से, right? An annual report has to be given every year. So if you look at the IMS Bhopal website, I have not checked for some time, but there is a section of reports, and you will see the report for MPPCB. वो बड़ा अच्छा रहता है उसमें कि how much water was generated this year and how it was treated, how much of it was handed over to other agencies, all those what kind of training was done, all those things are mentioned there, right? Then something related to the transport part. Transport is not only through pipeline, especially through public transport system. So the occupier has to get no objection certificate if the hazardous waste is being moved from one state to, especially to another state, even inside the same state from one district boundary to another district boundary, and often even inside the district also. So no objection certificate, and they have to follow something called as manifest system. Manifest is a system of movement document. So it has 7 copies in color codes. So a copy, say for example, 1 copy to the next state pollution control board, 1 copy to the same state pollution control board, 1 copy for the transporter. नहीं तो बीच में रास्ते में अगर देख लिया pollution तो fine लगेगा. A lot of fine is there. So a lot of things have come into place so that we do not get those dreaded diseases. It has not come, it is supposed to come in place now. So this is the manifest system, these are the color codes. And these are the functions of occupier. क्या क्या कर सकते हैं? Who can be occupier? Consider occupier. So anybody who is handling in liquid waste, anybody who is generating the liquid waste, anybody who is collecting the liquid waste, or storing, or packaging, or transporting, or using, or treating, or processing, lots of processes activities. Anybody who is doing any of these is an occupier and has to go through all those. So hospitals, of course, are doing a lot of these. How do we survey liquid waste? So in urban areas, it is the municipalities. They are supposed to do surveillance of liquid waste. In rural areas, there is something called as Village Health Sanitation and Nutrition Committee. It came in with National Rural Health Mission. 2005 में आया था ये first time. They are supposed to do it. So there are states which have taken this opportunity very well. Guidelines लिखा हुआ है. Those states are doing it. There are states who are not doing it. They are doing a research how good they are doing it. भोपाल में कर रहे हैं, राजस्थान में. I am the guide of a PhD student who is doing this. Let's see मध्य प्रदेश में कैसा हो रहा है. But not well. बहुत अच्छा नहीं हो रहा. CPCB and State Pollution Control Boards are the main entities. ठीक है. Right? And these are the ways it is done. ठीक है. There are laws related to liquid waste management. So this is the ministry which makes those laws. These are the act which has come into place, and this is the last law which has come into place now. It has very important features like how to dispose. Open land में नहीं करना है. Bulk user कौन है? Bulk user what they have to do. There is something called a dual piping, one for the sewer, one for the drinking water. There should be how separate they should be. वो अभी तक इसमें नहीं है कितना separate होना चाहिए. There is a concept of registration होगा, then monitoring होगा, reporting होगा. 7th every month on 7th, by 7th, every year by 30th, जो अभी just बात किया था. How reuse should be done. So 20% of total water reuse by 2078 to 27 to 28, 40% by 30. For existing users, only 10%. Recovery कैसे होगा? All these guidelines are mentioned in that one, right? Last quiz. अब बता दोगे, easy है ये, quickly. No? A, B, अच्छा C, B. We talked about it, right? दिखाए भी था ना, rain water harvesting is an example of reuse. Okay, so next class we have on micro environment at the level of households. How do we stop it?